Hello, I am Wes Moss. Welcome to Understanding Today's Healthcare. Maybe better said, understanding the cost of today's healthcare and understanding the coverage that you get with today's healthcare. Arguably, it's gotten to be the biggest question mark and line item or budget item when it comes to planning for retirement. Hey, how much am I going to spend for healthcare? And I've been a financial advisor for over 20 years, and the issue that I constantly now I'm sitting down with families, they're saying, Wes, our healthcare cost today has gotten to be the biggest budget item. It's worse than my mortgage in a lot of cases, or it's bigger today, or it's more costly than my mortgage was, when I bought my first couple of houses. It's a big deal. And there's so much confusion around healthcare because of Obamacare a couple of years ago. We had the individual mandate. Now the individual mandate's gone. But healthcare just in general is this quagmire of expense and coverage. And no better person than my good friend Al Schiebel, president of Shop Benefits, joining me today to declutter a very complicated concept or topic.
Thank you, Wes.
Well, thanks for having. Thanks for being here on the show. Now, Al, I'm going to dive right in with you've been doing this for how many years?
20 years.
20 years in the healthcare industry.
Yeah.
Did you ever think it would get this, just such a major line item on everyone's balance sheet? Did you ever think it'd be this politically sensitive?
No, I never thought of that. It was just we were trucking along before Obamacare took place.
Yeah.
And it was just, we knew that we needed to have some changes.
Mm-hmm.
But I never imagined something like this to take place.
And the reason I say that without Schiebel, again, president of Shop Benefits, is that the first half a decade or so I knew Al, healthcare came up, but it wasn't a problem that we had to solve all that often for. Right. And then ever since, let's call it the last the last 5 years, almost everybody I talk to, I say, you've got to go talk to Al to try to help solve your healthcare benefits, which brings me to my first question, which is, what do we do? And we're going to get to Medicare in a minute. We're going to get to age 65. And I think things actually, even though it's complicated, even when we talk about Medicare, Al, you're going to break that down for us and make it simple. But it's pre-Medicare. What do I do if I'm an early retiree? I'm 60 and I want to retire today, and I've got to get coverage over the next 5 years. So if I retire before age 65, how do I go buy health care?
First of all,
for me and my family.
Sure. First of all, if you work for a company that has 20 more employees, I would consider strongly looking into COBRA.
Okay. So meaning that if you just finished working,
right,
and you're with a company with a little bit of size or so, you say, hey, let me do COBRA.
Yeah. Now, let me explain COBRA a little bit if I could.
Please.
COBRA is a federal law. Most people think that COBRA is a health insurance plan. Mm-hmm. It is not. It's a continuation of benefits, or the benefits that you have through work.
That's a good distinction. So COBRA is just a government law that says, hey, you get to continue your healthcare coverage for 18 more months.
That's right.
From work. Got it.
Now, most people understand COBRA being that it's going to be very expensive. And the reason why COBRA is so expensive is because you lose the employer coverage, the employer contribution, if you will.
Right.
And so it becomes very expensive.
So if you were paying $500 a month in your paycheck thinking, oh gosh, $500 a month, now all of a sudden it's $1,000. Typically it's usually doubles because the employer part goes away.
That's
you
right.
got to pay the whole thing. So it's not that COBRA's expensive.
It's just that you're losing that employer coverage.
You're losing the employer
contribution. Yes.
Okay.
And so what happens with that is, the reason I recommend COBRA first, is because of not only the cost, but also is a known factor. You know the benefits, the doctors, everything about the plan because you've been on that plan.
So Al, our audience wants to know that, let's say I don't have COBRA coverage. I'm not working. I'm just 60 and I have another 5 years. I don't work for a big company, or I'm early retiree. And what do I do between 60 and 65 to get coverage? Again, I don't have COBRA. Do I go to an exchange? Can I go to Blue Cross Blue Shield directly? Do I go to Humana? Do I go to a broker? Do I go to Shop Benefits like you? Where are we finding healthcare?
So you can go. The answer to the question is yes.
All of the above.
So all of the above. if you go to the marketplace exchange, okay, healthcare.gov, you'll be able to go and find all the companies that are available for your zip code, because everything is related to your zip code. Okay.
So hold on, let's clarify this. Healthcare.gov is the exchange.
Is the exchange. Now, to clarify something about the exchange is that in the exchange, you will go, typically, if you go by yourself, you go without an agent, and the agent is not going to give you advice, is not going to give you direction, not going to be able to look at medications, doctors, and that sort of thing.
When it gets in the weeds.
Right. Also, if you go through the exchange, they're going to ask you about your income. And see if you qualify for a subsidy. Okay. And so if you qualify for a subsidy, that means that the government is going to help pay for some of your insurance.
If you qualify.
If you qualify for that. Also, you can go outside the exchange and go deal with a professional like myself.
Right.
Okay. And what we do is this: we take all the information from the person and just we ask questions about doctors and drugs and all that.
Prescriptions.
Right.
Yeah.
And in some cases, there are some agents that are certified to sell inside the exchange, and so they can help as well inside the exchange. Just know that there's a lot of agents that are charging a fee for that. So,
got it.
Yeah.
Are there some agents that are not charging a fee?
For the most part, they are.
Okay, well, you
Yes.
got to make a living.
Yes. Now, just to clarify, inside the exchange, the only reason I would go to the exchange is if you qualify for a subsidy.
Got it. So you don't
Okay.
need to use
Don't
the
need
exchange.
to use the exchange.
However, if I were to look at those three that are available, which would be, those are the only three individual
In
companies
the state of Georgia.
In the state
yeah.
of Georgia.
Now, but also there's some counties that only have one of those companies. So
For certain counties.
it just all depends on where you live.
If I go to the exchange, I can put in all my information, my income information,
Right.
and I'll get a quote. Maybe it's generic, maybe it's not. Maybe it's not specified on all the doctors
Right.
that are covered and all the prescriptions that are covered. But I'd get 3 quotes. Is that correct?
Well,
I'd get an Anthem, a Kaiser.
right, you do. You
and
do.
Better. Okay.
So, in preparation to this meeting, I ran some fictitious quotes. And
let's call them hypotheticals.
Hypothetical
In
quotes.
the financial world, called a hypothetical as opposed to fictitious.
Okay.
Okay. We're learning.
I got about 30 different quotes from all those companies.
That means you got a lot from each one.
Yes.
So you got the 5 levels, 10 levels from each one.
That's right.
Now, follow my thinking here, and I'm trying to
Right.
detangle why this is so darn confusing. Could I also though go to Kaiser directly or independently outside of the exchange? I go to Kaiser's website, if you will, and shop for a quote. Or go to someone like Shop Benefits, your company, and say, Al, I want coverage from Kaiser. Would you then just go shop Kaiser, or
Yes.
would you still go through the healthcare.gov portal?
No, I have my own access to Kaiser and Blue Cross, or Anthem Blue Cross.
Okay, so it's wrong to say all healthcare is now through the exchange.
All healthcare is available through the exchange, but it's also available through independent agents.
That makes it very clear.
Okay.
All healthcare, if a company is participating,
Right.
if a healthcare provider, insurance company is participating,
Right.
it's available on the exchange. But you could also go to them through an agent or
Right.
directly to their website
Yeah.
to shop.
Yeah, and the advantages of going with an agent is that you're dealing with somebody who has vested interest in
And really
your
kind
success.
of finding all the nuances.
That's right.
And listen, so I'll sell Al so you don't have to sell yourself. And this is what I've seen over the years is that it's a mountain of information to climb to try to coordinate. Let's say you have a family and you've got kids, and then you've got mom and dad, or maybe you're getting mom and dad, or one person's on one medicine, one person on another. Then you might have a specific doctor you like.
That's right.
And the dad has a specific doctor, and then you got the pediatrician, and now all of a sudden you have this complex fingerprint of the family healthcare that might not be a great fit, particularly for 1 or 2 or 3 of the 10 plans that you just described from Kaiser. But
That's right.
maybe plan number 7 from Kaiser could be good. Is that
Right.
fair to say?
That's right.
Plan number 12 from Ambetter might be the right plan that fits all those doctors and
That's
all
right.
the main prescriptions. And that's really what someone who is full-time within the healthcare system, that's really where you would bring value.
That's right.
If I needed a generic plan off the shelf, I wanted to go, I didn't care what doctors, didn't care about prescription, I'm not getting as much value by using someone. Is that fair to say?
That's right. Yes.
Okay. All right. That starts to make me understand this word. I think it's a wonderful description. They're available in the exchange, but you can
That's
also
right, they are.
find them outside the exchange.
You can find out about, yes.
Now, what's next on my list here? So when we say, again, let me clarify something. When we say Obamacare, is Obamacare really still, is it referencing, hey, I'm going to an exchange because I'm going to likely get a subsidy? Is that why people
Yes,
call it
it is.
Obamacare?
So people look at Obamacare and they think, I don't want to, people tell me, I don't want to be on Obamacare. Okay?
Sure.
And they're usually referring to, I don't want to be in the exchange. But if you think about it, Obamacare is the law of the land.
Right.
Okay? And Obamacare set parameters that insurance companies have to have in order for you to be, to have insurance. They have a list of 10 different things that they have to cover.
So to some extent, it's everything is, maybe it's an overgeneralization to say everything is Obamacare, but to some extent, that's the last prevailing legislation to overhaul healthcare, and that's why we call it Obamacare. And so to some extent,
would
everything
say
is
so,
shaped by Obamacare.
Everything is shaped by Obamacare, and that's the right way to see in it. So,
So let's talk about income for a minute here. Do you have an idea of, and I've looked into this on subsidies, and this is an ironic situation. You can be somebody, let's say, with $1 million, $2 million in an IRA,
right,
but you've stopped working.
right.
Let's say you're 60 and you're done, and now you have zero income. I'm painting a picture here of a pretty wealthy family that doesn't show any income. Could they get a subsidy? Let's say they literally have zero income for a year. Could you get a subsidized healthcare plan?
So they're looking at, and I'm going to answer that question in a minute, but they look at federal poverty level between 100 and 400. In dollars, it's roughly about $12,000 for one person, 100%, and $48,000 for 400%.
That's of the poverty level. So in America, if you're single,
right,
you've got to be, the poverty level is around 12,000.
Roughly, yes.
Roughly.
It gets adjusted, index adjusted every year, but it's around $12,000.
And for a family?
For a family, well, every family member, they just add different levels for
of it.
that,
Okay.
yes.
And for children as well, right?
That's right. That's
so
right.
in order to qualify for a subsidy,
Right.
you've got to have income in that 100 to 400% of the poverty level.
Right.
And the more children you have, the easier you qualify?
Typically, yes. So to answer your question about if somebody having zero income, right?
If you have no income
If you have no
whatsoever,
income, you don't qualify for any subsidy. You have to be 100% or above federal poverty
do you think
level.
that's a mistake? Is that a loophole?
I think it is. Because if
So
you're...
again, if you make $12,000
Right.
poverty level, you're at the 100% of the poverty level,
Right.
you would qualify for subsidy. But if you made $4,000 a year total, you're so far below the poverty level that you don't get any subsidy at all. No sense whatsoever. Unbelievable.
Technically, you would qualify for Medicaid, but there's some qualifiers with Medicaid, and that's a different story.
That's interesting. So if I then am a retired couple, and this is somewhat
Sure.
gaming the system, and I have plenty of money, I still want to show a little bit of income
You do.
to get to the right poverty level
Sure.
in order to get a supplement before I start creating a lot of income in retirement.
That's right.
Maybe have a couple years of low healthcare costs.
I have a client, for instance,
Yes.
that lives in a gated community. Okay,
Gated.
yes, and he's got assets and all that, but his income is showing.
Probably your next door neighbor
That's right.
in your gated community.
Yes. And so he has arranged his income in such a way that he falls above the 100% federal poverty level.
Just above.
And he's getting subsidies for
you
Obamacare.
just said it. See, you're part of the problem. It's not Obamacare. It's a supplement of healthcare.gov.
It's a subsidy.
Subsidy. Subsidized
Supplement is
healthcare in
different. So
all right. So you can really you can. It's not gaming the system. It's the law is the law. The law is the law.
it's between you and the tax man. So.
The law is the law. Now, the next question I have here, if I am getting that subsidized healthcare plan from XYZ carrier, Anthem, Kaiser, and I'm getting a subsidy because I have a low income in a particular year or any year, is my coverage any different because it's subsidized, or is it exactly the same as somebody who's paying full boat?
It's a good question. So if your income is between 100 and 250% of the federal poverty level, you get an additional reduction in benefits, improvement in benefits. Okay,
an additional improvement in benefits.
So it could change your deductible, it could change your copays, it could change.
So it could
things.
lower it even more.
Yes, it could.
Really inexpensive.
Yes.
Now I can suspect then from 250% of the poverty line to 400, you don't get any help. You don't get as much help on your deductibles.
It's graduated. It's means tested. So.
I am really learning this. That makes a lot of sense, though. And then above 400% of the poverty level, it just the cost is the cost.
The cost is the cost.
Can we talk about the cost for a minute?
Sure.
Here? I don't know if you're prepared for this, but can we get some average costs for a family, individual, gold, silver, bronze, platinum, tin?
So it varies from. It depends on your age. Depends on your county. Depends on your zip code, okay? But I ran a number for a husband and wife.
You did some homework for us.
Be 63 male, 60 female. The range is between $1,400 a month and $3,000 a month.
And how many different quotes did you get?
There were about 30.
30 quotes.
Yes.
And again, 10 from each about? Was it 10 from
roughly, yes.
And there's 14. Now, the bigger, again, you don't have to go into the minutiae here because we're on the radio or a podcast. We're in general, how big of a difference is there on these deductibles? I would suspect that's the biggest difference. If the $3,000 a month versus $1,500 a month, what's the biggest?
The $1,400 a month deductible was, if my memory serves right, is about $7,900.
$7,900
for an individual.
Let's round that up. That's $8,000 a year almost.
For an individual, yes.
And the $3,000,
and the $3,000, I believe it was
somewhere around
like $500 deductible.
$500.
Yeah.
So very, very low deductible.
Yes.
Wow.
But things.
See, I told you didn't need any notes. This is all coming off the top of your head. You got it.
I have stuff.
You're a genius about this. You really are a genius about this. Who are the major healthcare insurance companies that operate in Georgia? We already did that one.
Right.
We know that. Anthem, Kaiser, and Ambetter.
Ambetter, just to give you a background, Ambetter was typically in the Medicaid market.
Medicaid.
Right. And so they enter the mainstream market about 2 years ago. You can only buy that through the exchange.
Ambetter's only available on the
exchange,
exchange.
yes.
Right. You can't go outside directly to Ambetter. Got it.
I made a decision not to get into Ambetter, not to sell Ambetter. Just
let me ask you this, though. Again, I know that I can go to the exchange and maybe qualify for
a subsidy. Yeah.
A subsidy.
Right.
But if I don't qualify for a subsidy, then I can still go to healthcare.gov.
You can.
If I want to.
Yes. So there's a way that when I was looking for these rates, just for example, I did skip the income part. Okay. And you can just get rates.
Get rates.
Yeah.
Through healthcare.gov.
Through healthcare.gov.
You absolutely can.
Yeah. But it's kind of like changing the oil by yourself on your own or bringing it to Jiffy Lube and get it fixed.
The question then, this goes back to the cost. One good example that Al talked about here was the $1,400 all the way to $3,000. It's a huge range. One had a huge deductible, one had a little deductible. This kind of makes sense. A lot of it is deductible then. I remember when we first got Obamacare, if you will, I remember very clearly there was gold and silver and platinum levels.
Right.
Is that persisted?
Yes.
And did they add more, or are there multiple versions of gold and multiple versions of silver now?
It's 4 metal levels. Like you said, platinum, gold, silver, and bronze.
4 metal
levels, yes. And the metal level is based on the actuarial value of that plan.
All right.
Okay, and so
The actuarial value of the plan.
yes, so ACA's established some parameters that a plan has to meet certain requirements in order to be called that metal level.
All right.
Okay, and so you might, for example, have a plan that is a gold level this year, and the plan doesn't change too much for the next year, but the next year is a silver level. And just because actuarially it changed.
If I had a button to make a sound effect, it would be a snoring button right now.
Yes.
It would be our audience is snoring. They have tuned out. For the very few people that are still listening, we're going to continue on here. But you're doing your best to explain this because it's really, there's a lot of minutiae here. Let's talk about this, deductible levels here. Every day when I talk about healthcare, a family will say, Wes, why isn't there a plan that I can just go out and, because I'm a healthy guy, I climbed a mountain last week. And I only am a vegetarian. I'm a pescatarian, and I've got low blood pressure, and I have no buildup in my heart, and my wife and I are super healthy. Okay, that's great. One person go find virtually what I think I would call a catastrophic plan that says, look, I don't really need much throughout the year. I might only need a little bit of coverage here and there, or maybe zero, but I want coverage if I get hit by a car on my bike ride, or if I get cancer, or if I get something, a big outlier type event, but it could cost $500,000 million. Does that exist?
No. ACA establishes parameters for deductibles. Now, for ACA compliant plans, okay? So the maximum next year, I believe, is $7,900. That's the maximum deductible you can have in a plan for next year.
So there's no and that sets the law for the land. So there can't be a $20,000 high deductible plan somewhere that covers $1 million worth of costs.
Now, ACA compliant plans. There's other plans that are short-term medical plans that you can have a little bit more leeway. And
would you call those high deductible plans, or is that
there's
out there?
some plans that have a little bit higher deductible. It just all depends on the insurance company.
Wow. Let me ask you this on the mandate, Al. I don't know if I prepared you for this one. Again, we know that healthcare, when Obamacare came out, I can't even remember the year. Was it 2010, 11?
March 23rd, 2009.
You remember. It was 09.
Yes.
And I remember the mandate was you have to get healthcare in America or else you get a penalty.
Right.
This, again, correct me if I'm wrong, it's 2018, the new tax law eliminated the one part that it eliminated was the mandate that you had to go buy healthcare coverage.
Right.
Is that correct?
That starts in 2019.
So yes. Starting next year, the 2018 tax law says you no longer have to.
Right. But as I understand it, 2018, you still could be penalized for not having an insurance plan.
18, yes, but starting in 19.
In 19, yes.
You're no longer
required to have that.
To have healthcare coverage.
And that's where short-term medical plans could be available. So somebody can go into a short-term medical plan is not ACA compliant. So that's
and do that, what are you talking about? Doing that in 2018 until now, until 19?
Well, starting 2019, start a plan that is not an ACA inside the exchange.
Who are those players, or do we want to go down that rabbit hole?
We could.
I don't think we do. I think we're going to hit the double snooze button at that point.
Sorry about that.
That's okay. We're solving the really big questions here, and this is wonderful. The exchange, what is it? Cost for family deductible levels. We talked about the deductible levels can be $500, like a really expensive monthly premium, all the way up to $7,900
that is
total.
Correct. Yeah.
And the other question I guess I have here on healthcare, and we haven't gotten to Medicare yet, but with a healthcare plan, let's say it's a silver plan, is there a set amount that is covered like an 80%, 20% like Medicare, or this is really kind of per procedure? Or
it depends on the plan. There's some plans that are 80% covers 60%, 70%. It just all depends.
And then if it's a 90-10 plan, the 10% goes towards your deductible, and then your deductible is met, you're typically done.
It all depends.
Let's use the word typically.
You have typically, yes. You have a maximum out of pocket also that you're subject to.
Right, which is a little different than your deductible.
Yes, sir.
Max out of pocket, little different than your deductible. That makes sense, though. It's two numbers, and those numbers, for example, they're not that different, are they? I mean, I remember us looking at some plans over the years where the max out of pocket. It's not like that's $50,000 and your deductible is $5,000.
No,
they're a lot. Those numbers are typically fairly close.
Right. ACA also puts limits on the maximum out of pockets.
Yeah. Okay.
Yes.
All right.
And so the maximum out of pocket also includes the deductible.
The max out of pocket includes the deductible. Right. Makes sense. All right. Now we're going to get to Medicare in just a minute here, folks, and we're going to explain that. But we're getting a lesson about healthcare in America from Al Schiebel, president of Shop Benefits. If you're just tuning in here to this podcast, what are you? If the answer is there are no catastrophic type plans out there, and I guess the answer is why not? It sounds like it's kind of because of regulation, and it maybe from an insurance perspective for companies, it doesn't make sense. I don't know why there's not that out there. There seems to be demand for it because our next topic has to do with Medicare plans, which I think are the closest thing to what a lot of folks are looking for. You just gave me an example that your average plans $1,400 a month, and that was for a family. It was a couple.
So two people in their 60s.
In their 60s, though. So $1,400 to $3,000, which is an astronomical amount of money. It's just unbelievable amount of money in America. But a Medicare plan, I have clients that are paying $300 a month.
That's right.
$450. A client just the other day said, "Oh, Wes, my Medicare plan." He said it's not cheap. Still, but it's $450 a month, which is still a lot of money. It's not $1,000 a month. Now he was in really good health and was the candidate for that proverbial catastrophic plan. He didn't think he'd ever get sick. God willing, he won't. But have you dealt with Medicare plans yet? Do you think they're legitimate? Do you like them?
Personally,
let's describe them first of all.
Okay,
to the listener.
So a Medicare plan is you get like-minded individuals that go and pay into a fund, if you will, and they share in your unforeseen medical expenses. Okay, and so you have certain
10,000 people pool together.
Right.
They all pay a premium or a share, if you will, and 20 of them get sick. The pool goes to pay for those 20.
Correct. Yeah. Now, the thing that really concerns me is that it's not an insurance product. Okay.
What is
it's
it?
not insurance. It's just an
agreed upon
pool. And so it's usually administered by a company. And so that you send all your premiums to that company. And then what happens is that you have like a deductible, quasi-deductible you have to apply, you have to satisfy, and then there will be sharing. Okay, and so what happens though?
And let's name a couple of those companies.
You have Liberty Share. You have Medishare.
Oh, Medishare is the name of a company too.
Yes.
Yeah, it is.
You have Alera Health. You have, did I say Liberty Health?
Liberty's a big one. Medishare.
Yes.
Okay, so there's a handful.
Yeah, and a lot of times they have the same. You have to have the same thought process. Okay,
and that's why they're predominantly Christian.
They tend to be on a Christian base or faith based.
Yes. Not just Christian, but faith in general. So you agree. You have to sign a contract. Again, none of this it's not really legal. It's not a legal contract. It's almost a statement of faith.
Yes, it is.
Hey, I'm going to live a healthy, quote, healthy lifestyle. I'm going to go to church. I don't drink. I don't smoke. Is it part of the lifestyle?
It
You
is.
say, I walk my dog twice a day.
I'm not sure specifically about that.
I take the stairs. I promise to take the stairs and not the elevator. No red meat.
I'm not sure it gets into those specifics, but it is something about you have to have the same faith, or you have to live by the Christian principles.
All right.
And so, if you're a smoker, if you're a drinker, you may not necessarily qualify for that plan. Also, the other thing is this: it may be pre-existing conditions. So beware of the fine print. Read the fine print before getting into those plans.
I have heard that they may very well not cover certain pre-existing.
Yes. And in some cases, it may cover limited medical conditions for a certain period of time, and in some cases may not cover anything at all.
As an example on the mandate and pre-existing, because the mandate quote, the mandate is you have to get insurance, health insurance, because that's going away in 2019. Do we think that the pre-existing condition, which is, again, correct me if I'm wrong here, one of the big changes, obviously, was that healthcare companies now would say we can't exclude you for pre-existing conditions. Is that still going to be the case even next year, where individuals no longer have to get healthcare? Will healthcare companies, I guess it's really a separate issue, pre-existing condition coverage is still not going away?
It's not going away if you go with the ACA compliant plans.
ACA compliant plans.
Yes.
Got it. Again, those would be through healthcare.gov.
Either healthcare.gov.
But again, through most of these plans that we've talked about, Anthem, Kaiser, they're going to be ACA compliant. So even if you don't go through the exchange, they're still going to have to cover your pre-existing conditions.
There's 10 essential benefits that they have to cover.
10 essential benefits.
Yes. And we can get into that at another date. But
wow, that's a whole nother episode.
That's another episode.
Well, no, just give me one or two examples.
You have to cover pregnancy. They had to cover rehab services.
Rehab.
And things like that. So
that makes sense. We've used the pregnancy option a lot in our house. We have 4 kids, so I think it might lead to rehab, though, too. No wonder those two are coupled together.
And there's mental rehab, too.
That's actually where we really need to be in our family. So let's get to Medicare. Let's go to it's so much clearer to talk this through with you. It's not as hard as people think. But it's just hard enough for you to have a very important job.
Thank you.
And it's not going away.
I really think it is. So.
It is. So can you brief? So now I want to just talk about Medicare, right? You got Medicare ABCD.
Right.
And why don't we just go super quick through high level what A is, then B, then C, and so forward.
So the biggest thing that I tell folks is that let's break it down in little pieces, parts. Okay. Medicare A and B. That comes from the government.
That everybody gets at age 65.
Everybody arrives to A and B.
Got it. A and B, and A is?
A is for hospitalization.
Got it.
And B is for doctors and outpatient procedures.
So you got to have A and B.
Yeah. That's considered original Medicare. That's in my circles, that's called original Medicare.
Got it.
Okay.
And you call that, so A and B, everybody gets it, and that, by the way, that covers, again, A and B covers
about 80% of your expenses.
Got it.
Yes.
All right.
Now, if you had A and B only, there's deductibles to deal with A and B. And so that leaves you at risk. Okay. Also, they don't cover drugs.
That's when we're going to get into part D for drugs.
That's right. Yeah.
Hold on one sec. Just as a reminder, in general, A is zero cost.
There's no premium. You're right.
Premium.
And then Part B, there's a premium. There's a base premium, and then depending on your income,
based on your income.
Yes, and it's $170,000 or more. Your income goes. Your cost will go higher.
Okay.
So in my industry, we say is means tested. The more money you make, the meaner they get.
Means tested. I hadn't heard that. That's easy to remember. All right, so that's pretty simple. A is hospitals, no premium. B is doctor's office visits.
That's right.
Premium based on income.
Right.
C and D.
Okay.
Does C and D, is that where the other 20% comes?
Maybe.
For the most part.
So there's 2 routes. So Yogi Berra used to say, if you come to a fork in the road, take it.
Take it.
Okay. So there's 2 options that you have to take. Okay. One way is take Medicare Part C, which is Medicare Advantage. Okay.
It's called C equals Advantage.
Yeah, Medicare Advantage. And so Medicare Advantage, what it does is that it takes parts A and B and adds a drug plan and its own one provided by one insurance company. Blue chip type of companies, if you will.
Medicare Advantage plan,
right?
Part C.
Yeah.
Okay.
And so
it gives you a supplement for A and B.
It's not a supplement. It's just basically what it does with Medicare Part Advantage takes over what A and B does.
Okay, well, that's what I mean. So it pays the other 20.
So,
percent.
It's a little bit different, because Medicare Advantage is that they have their own terms and conditions, and it's all based on a copay all based on a maximum out of pocket, et cetera, et cetera. Medicare Advantage plans have networks. You could have a PPO, you could have an HMO, you could have a that sort of stuff, point of service type of plan.
Right.
And so you have to go to the doctors in that network. You see what I'm saying?
Sure.
It's a little bit
That's
complicated.
what a C does.
Yes.
Okay.
And
then but again, it's also meant to do. So it's really meant for your drug plan and to help cover the 20% that A and B don't cover.
Well, it's a little bit different.
It is, okay.
And the reason why I say it's a little bit different is that with a Medicare Advantage, you put away your Medicare card, and your Medicare Advantage takes over what A and B does.
Oh, got it.
But anyhow, with a Medicare Advantage, though, it's important that you talk to somebody about it. And the reason why is this: don't get enamored with a price. Okay.
For instance,
Medicare Advantage. There's some plans that have zero premium. Okay, and there's some plans that go higher. Okay, and so I've been to meetings that people say, buy my Medicare Advantage, zero premium. Okay, and
what's the catch? Obviously,
well, there's usually no catch. But what happens though is that that person is that individual that just buys based on price is not looking at, is my doctor in the network, is my medication covered, et cetera, et cetera. So it's important to talk to somebody that reviews that information on behalf of the client, on behalf of the applicant, because what you don't know could bite you.
So Medicare Advantage plan could have a premium of, again, zero,
yeah,
all the way to
could be as high as $75 this year.
a month.
Yeah,
Total.
yeah. But you still have to pay for your Part B premium.
So okay, that makes sense. That makes sense. Now let's talk about D then.
D is so you can buy a standalone D plan, okay, and those plans range between $15 and $60, $80. Different carriers also, but it all depends on the medication that you take. Now, if you buy just a D plan, that leaves you exposed with that 20%.
Right.
That's where Medicare supplement comes into place.
Okay.
And so usually when you see a supplement, a D plan is added because supplements do not cover drugs.
So Medicare supplement plan is not the same as a Medicare Advantage plan.
Correct. That's why I said take a fork in the road. When you come to a fork in the road, take it. It's either one or the other.
Medicare supplement plan is really a supplement and D.
Right.
And that's different than a Medicare Advantage plan.
That is correct.
That makes so much sense now.
Thank you.
Al, as we wrap up today, and I feel like our audience has probably gotten a lot of clarity. If you made it through what in some cases was a little bit of a snooze fest, if you got through this whole thing, you have a real understanding of healthcare in America. So you do a wonderful job of breaking it down for us. I guess my last question would be, what's the number one question you get from families that are about healthcare and their plans?
Well, one question that I was going to say about Medicare, if I could, is somebody calls me and says, I'm turning 65 and I plan to go to work, still continue to work. What do I need to enroll in Medicare?
Right. And the answer is?
Depends. Okay.
Fork in the road.
Fork in the road. Yes, that's right. Because if somebody works for a company that has 20 more employees, it's different than if you work for a company less than 20 employees. So if you enroll in a plan, you need, if you work for a company that has 20 more employees and you enroll in that plan, you still can continue to work and not enroll in Medicare. Potentially. So you need to talk to somebody that could give you direction. You refer me a lot, some folks that occasionally they come to me and they ask me the same question. And I go, stay where you are. And they're very thankful for that.
You don't need to go buy a plan.
Don't need to buy a plan right now.
Even at age 65.
Yeah, because, if you enroll in Medicare Part B and you still keep on working, you're paying for Part B for nothing because Part B is secondary at that point.
That makes sense. So we talked about Medicare, which again can be confusing as well, but we now learned that Part A is relatively, let's call it free. Part B is based on your income on those premiums. And then for Part C and D, what are those? Well, C is the Medicare Advantage plan. And then we have a Medicare supplement plan that you would also have to have Part D, which is the drug plan. Al, did I get that right?
That's right.
Wow. It's a lot to take in, but I think today really gives us an explanation of one of those. It's important in so many ways. I don't have to tell the audience that or else you'll be watching, but it's expensive, healthcare in America. It's complicated because it's changed 20 different times and it continues to change. But I think today gives us a good idea of what we need to do to understand it. If we need to go reach out to somebody like Al, if we have a complicated situation, hey, what's the best coverage or plan that's tailor fit exactly to me so I'm not spending too much? I've got the right deductible. I think we answered that here today. So thank you for tuning in. A reminder, if you haven't listened to Money Matters, you can find the podcast at Wes Moss Money Matters. It's the purple icon, which is the podcast app on the iPhone. Again, just Wes Moss Money Matters. We typically post a show at least once a week, and you can find me and the team, the Money Matters team, at wesmoss.com. That's WESMOSS.com. Thanks for tuning in, and have a profitable rest of your day.